Hey everybody, Dr. Michael here. This time of year, following the snowstorm that we just had, we just yesterday had 3 people that had come in and taken falls. And they all had been putting heat and ice and doing everything they probably shouldn't have been doing. So I thought it was important that I've told many patients over the years what I'm going to tell you today, but I thought I'd just put it out there to everybody, okay? Rest, ice, compression, elevation, okay? So you want to rest it, you don't want to overdo it. You want to ice, you want to use compression for a few days, wrap it up with an ACE wrap or something like that, or if you have a compression sock, that works too. And elevation, right? So when you elevate, you just want to get it above your heart. So say you twist your ankle, you do something like that, you want to lay down and get it elevated up. Obviously, if you have a strain in your neck, it's automatically above your heart every time you're standing or sitting. So, but what we really want to go over today is the confusion that people have over icing, okay? Do you use heat? When you use heat, when you use ice? You almost always use ice. Ice is the anti-inflammatory, okay? So the way to use ice is 20 minutes on, hour off. You don't want to put an ice pack like this, a gel pack, directly on an injured area, because our skin has a hard time telling the difference between really cold and really hot, okay? So say Marilyn had twisted her ankle here on this outside and it was swollen up. You'd take and put this wrap right around, or the ice pack, single layer like this, nothing thicker than an old t-shirt, an old pillowcase works really great. And the pillowcase is nice because you can then wrap it around like this and it'll stay in place, okay? Same thing if it was the knee. If you have elastic wraps or anything like that around, we're a clinic, so of course we have them around, then it makes it actually easy for people to get up and walk around. Just because you have ice on doesn't mean that you can't be mobile. You can get up and do things when you're icing. It actually helps. So if it was her knee, we would do it that way. So I want to show you what to do with if it's your lower back or your neck. So I'm going to roll over Marilyn. So say Marilyn strained her low back here, right? So again, we'd have our cold pack, a larger one like this. With a low back, a larger pack is better. A smaller pack can be fine, but it doesn't work quite as well. But you would bring it, put it right in the waistband. The nice thing is with a waistband is it allows us to get the ice down in there. So say it was right at the waistband, you want to tuck it down in a couple inches and leave it up above a couple inches. Now with this, Marilyn could actually get up and walk around and take care of things she wants to do. She could be in a seated position, she could stand and walk around, you can do some chores, whatever it is that you feel like you are able to do. Remember again, you're trying to rest some. But movement helps with blood flow, so we do want to have some movement. Up in the shoulder region and the neck, it's a little bit different. A smaller pack might be better for something this size. A larger pack, if you can get it on there, covers a larger area. You'd want to get it up in the neck and then down over the upper trap, the rhomboid area, that part where the shoulder blade and the neck come together, okay? And so the reason why we want to only do and follow the sequence of 20 minutes on, hour off, is because the science of icing is that when you put the ice on and the skin receptors in there go, that's cold, it starts to constrict. About every 5 minutes it opens up and it goes, oops, still cold, and it tightens down, opens up, still cold, until those receptors go numb. Once those receptors are numb, at about 20 minutes, the whole process stops. So we take it off then for an hour. We let that receptor reset so that it's now sensitive to hot or cold again, and we start the process over. So it's 20 on, hour off, 20 on, hour off. If you follow that sequence, you can't over ice. And again, during the first 48 to 72 hours after any kind of strain, you know you strained it, or if you woke up with one of those horrible kinks in your neck, this is the formula to follow, okay? If you need us, we're always here, but I thought I'd throw this information out to people because it's so, so important. All right, thanks, have a great day.